So last year, our most popular video was this one here, where we got a real example of what an interview is actually going to be like, so you can see it for yourselves. And no surprises, the comments were all saying, could you do more of these? So we have managed to get another one for you. Again, I'm not going to tell you which university it's from, and you can try and guess for yourself. But here you can get a feel for what kind of questions are going to be like. You can get a feel for what an online interview will look like for you when you sit it, and help you prepare for when you have your MMI. So keep watching until the very end, because after you've watched it and understood all of the things that I'm going to show you, at the end I'm going to show you how you can use that information to maximize your performance. All of the training of FutureDoc gears you up to absolutely smash these interviews in the exact format that they need to be. So if you want to find out exactly how you can get some one-on-one help to train you to do the interviews in the exact same way and get through that final hurdle to get your offer, whether it's medicine or dentistry, you can check out that video that I just pointed out, and that will help you find out how you can get some one-on-one help with us. Otherwise, we have a fantastic online course as well that you can check out here, and that will help give you most of the knowledge that you need to do really well. Now, also what we're going to do, we're going to talk about some of the feedback from that, and we're going to critique the answers and give some feedback to that student as to how they could have performed better, so that you can understand whether they got the question right, and also adapt your kind of how you're going to perform with that based on what they said. So enjoy the video now, enjoy the interview, and then I'm going to show you what the correct answers were and critique this person's performance so that you can take those lessons and apply them to your own interview technique to better your performance.
Hi there, Braden. My name is Daniela. I'm going to be asking you some questions today. My first question is, you are a third-year medical student on a clinical placement. A fellow medical student who is doing rounds with you often shows up to these sessions tired, messy, hungover, and has sometimes confessed to be drunk. One day, you find him in the lunchroom unaccompanied, so you decide to talk to him. Please enter the lunchroom and have a conversation with him. You have 5 minutes in this station. So your time will start now.
So hi, Jack. How have you been?
Hey, I'm good, thank you. How are you?
I'm doing all right, yeah. Placement's kind of tough, but I'm hanging in there.
Yeah.
No.
Tell me about it. I've really been struggling.
Oh, okay. If you don't mind me asking, could I kindly ask why have you been struggling lately? I kind of noticed that sometimes you might come in a bit late into clinical placements, or you might look a bit messy. And so then I want to know why. Yeah.
Yeah, I mean, there's just so much going on, and there's just so much to do, and like so much. I still haven't done like all of the assignments that were due 2 months ago, and my consultant is just awful. He hates me. And yeah, I don't know, like my mental health isn't great. And I don't know, don't really want to be here, to be honest.
Right. I can kind of understand how you're feeling, because I know it's a bit stressful, being overwhelmed with work, not enjoying your supervisor. Have you tried doing anything about it to address sort of your mental well-being?
Well, I mean, the only thing that really helps is having a drink. Who doesn't love a good drink? Like a glass of wine just sorts it right out.
All right. So for me, the primary concern is that you should always make patient safety first. I mean, if you're drinking, I believe you won't have the capacity to treat patients safely and put patients at risk. That's the primary concern. And I believe to deal with your mental health, I have some stress management techniques. If you would like to hear them, yeah.
Well, I mean, I don't really think I'm putting patients at risk. I'm not the doctor. I'm just a medical student. So like the doctor's the one who's looking after them. I'm just here for the ride.
Right. I can see where you're coming from. However, I believe that you're a medical student and you're there to learn. And being intoxicated, you're not able to fully learn and absorb all the knowledge. And in the future, it is you that's going to be treating the patients, and the patients are in your hands. So I believe you're sort of indirectly putting the patient safety at risk.
Yeah, but like I'm not really that intoxicated. It's just one drink. And like there's no rule that I can't have one drink before coming into placement. And like it's not that bad.
I understand it's just one drink. However, it's putting patient safety at risk, as you should understand at this point, because you're a medical student.
Yeah, but what if I'm not even like talking to patients? What if I've just come in like just for like teaching?
Well, this, as I said, it would affect your learning, and I believe you shouldn't drink. It will affect your learning process, and you might put patient safety at risk in the end. However, I believe that you don't have to have a drink now, just before you come into the hospital. You could have a drink maybe during the weekends when you don't have any obligations. Yep.
Yeah, I mean, I don't really get what the big deal is. It helps me. It helps me to be more fun and to be, you know, feeling much better while I'm here. So I don't get what the big deal is.
Could I just ask you, do you think drinking helps your stress levels or your mental well-being?
Yeah, definitely. I feel so much better after I've had a drink.
Well, I can tell you some stress management techniques if you don't mind, so that maybe perhaps you don't have to drink and you could manage the stress well. For instance, I know sometimes I'm overwhelmed with work, and what I like to do is I like to form a support network with my family or friends, so I can rant about them, about all the problems. Sometimes during the weekends, I like to do activities that helps me manage stress, such as, for me, playing golf. I don't know, for you, maybe drinking. But yes. And also, sometimes I suggest you, if you're feeling really stressed and overwhelmed at work and it's really affecting your learning, I believe you should go see a mental health nurse and to deal with this. And hopefully she or he will give you lots of good advice on how to manage your mental health as well. I can also send you some pamphlets or some websites which has some good advice about mental health and also, stress management techniques. So yeah.
Thank you. That's the end of your station.
Yeah. Thank you.
Okay. My next question is, please tell me about a current public health campaign that you have heard of recently.
So the most recent public health campaign I have heard of is the COVID-19 vaccination program rollout. And and COVID-19 was a major pandemic that hit the UK pretty hard, caused significant damages to the healthcare system, and also created a lot of reforms on how healthcare should be done. So, for instance, COVID-19 is a virus, and it's spread in it, and it is an infectious virus that spreads through droplets. The way viruses work is that it has sort of a DNA or RNA, which is normally encompassed by a protein, and it has a lot of spikes on the top. These spikes goes to the receptors of our cells, and our cells detect this and incorporates this into them, and the viruses will incorporate the DNA, and that's how they replicate. So this was quite a problem because the COVID-19 vaccination relied on ACE2 receptors, which can be found a lot at the bottom half of the lung. Therefore, COVID-19 viruses were incorporated at the bottom part of the lung, which caused a lot of complications such as fluid buildup, unable to remove bacteria or other viruses, and ultimately maybe pneumonia and breathing problems. That's why COVID-19 was really deadly. And it spread really quickly around the UK. So in response, the whole world collaboratively gathered together to create a vaccine. And what a vaccine does is, normally a vaccine takes, more than 10 years to create. However, this COVID-19 vaccination was created within 1 or 2 years, which was amazing. How a vaccine works is that a vaccine introduces sort of the attenuated or less severe version of the virus, for instance, just a spike into your body, so that your body's white blood cells will detect this. And the white blood cells are basically the army of your body, which protects against pathogens or other viruses or bacteria. And it trains and this attenuated spike would train your army so that it multiplies rapidly in order to fight and recognize further infections such as the COVID-19 vaccination. So the government, what they did was they decided to roll out the COVID-19 vaccination. The main aim of the COVID-19 vaccination was to create sort of a herd immunity, meaning that the majority of the population of the UK would have defenses or would be resistant to this COVID-19 virus. This helps in a way because COVID-19 relies on the transmission from one individual to another. And by having herd immunity, it blocks the chain of this, so it prevents the spread, and eventually the COVID-19 will sort of die out. There are many implications about this COVID-19 vaccination because the government decided, they were really putting emphasis on making the COVID-19 vaccination sort of mandatory, and everyone must have a COVID passport in order to visit certain places such as the pubs. And I believe there are some good things and bad things about this COVID-19 vaccination being made sort of mandatory. For instance, the COVID-19 vaccination has been proven to be really safe, and before the rollout, it has showed minimal side effects, so it's generally safe to roll out for the public. It also helps to, first of all, tackle the COVID-19 virus. Therefore, it puts less pressure on the NHS. The NHS would be less overwhelmed if sort of like a swarm of people with COVID-19 just came in. Also, COVID-19 sometimes have long-term effects, which are still unknown. And by having this vaccine, the people will be prevented from having these long-term effects, and overall, the NHS will be less swarmed in the long run as well. Some of the bad things about making this COVID-19 vaccination mandatory is that, first of all, it breaches the autonomy of the people who are making these decisions. They have a right to have treatment, which they believe to be in the best interest for themselves.
That is the end of your station.
Thank you.
Thank you. So my next question is the following. A 14-year-old patient requests birth control pills from you and asks that you do not tell her parents. You are a doctor at the GP practice. What do you do in this situation? Okay, your time starts now.
Right. So if the 14-year-old girl came up to me, I would have to consider some points. I will have to consider if she is capable or has the capacity to make the decision for her own benefit. For instance, I will use the framework of Gillick competency or the Fraser guidelines. Both of them covers testing if the child is capable enough. What I mean by a child is anyone under or the age of 16-year-old, to see if they're competent enough to make the decision for themselves. In particular, the Fraser guideline is related to sexual health and treatments for children of this age. So I would test her. I would make sure she's mature enough. I'll make sure she understands all the information I gave her. Make sure she's able to use the information to weigh up the pros, the cons, and the alternative options of what she's asking. And finally, make sure she's able to communicate this with me, whether it's to verbally, written, or non-verbal consent. I will also have to think about sort of the pros and cons of giving this contraceptives to the girl. For instance, if the girl wants to have this contraceptive, I will have to respect her autonomy of making, because she made the decision for her best interest. So I want to involve her in her own healthcare. Maybe by not giving the contraceptives to her, I'm causing her maleficence. For instance, she might continue to have sort of unprotected sex, and it would have sort of a long-term effect on her. Also, by not giving her the contraceptives, she might become sort of pregnant, and this will affect her mental health and well-being in the long term as well, and also her family as well. Also, when I'm considering about giving her this contraceptive, I also have to understand that maybe her partner is above the age of 17 or 18, and this could raise potential issues. And if I identify that, I can refer to us to some local children safeguarding issues as well. Yeah, that's my take on it. Thank you.
Great, thank you. You've still got 2 minutes, so feel free to add anything if you would like to.
I think I'm happy with my answer. Yep, thank you.
Okay, I'm going to send the next question in the chat as well for you to read, but I will read it now as well. So, an 18-year-old female arrives in the emergency room with a profound nosebleed. You are the physician and you have stopped the bleeding. She is now in a coma from blood loss and will die without a transfusion. A nurse finds a recent signed card from Jehovah's Witness Church in the patient's purse, refusing blood transfusion under any circumstance. What would you do?
Okay, so when the patient comes to me and I've seen the Jehovah's Witness Church, I believe it's very important not to assume that the patient does not want blood transfusion. I believe I would look for some signs of consent from the patient, such as maybe having an advance directive, just in case this happens, I'll get blood transfusion, or someone with, or the patient gives someone the lasting power of attorney to make a decision on their behalf. If this is all, I will do all of this if the patient is unconscious. However, if the patient is conscious and if the patient is conscious and able to verbally communicate with me, I'll make sure that the patient is capable to make the decision on their behalf in their best interest and able to consent. Yep, consent to the blood transfusion. For instance, I'll give them all the information, make sure they're able to retain the information, process the pros and cons of not having the blood transfusion and any other alternatives, and communicate that back to me, whether it's verbally, non-verbally, or written. However, if the patient is critically in need of a blood transfusion, and I will have to make a judgment call, I will not make that call alone. Firstly, I would determine how much time the patient has left before they critically need the blood transfusion. If the patient happens to have lots of time, I will consult with the multidisciplinary team to see what are their views on this. As one of the pillars is non-maleficence or beneficence, providing the best benefits or no harm to the patient, and the patient is in critical need. After considering these ethical pillars and consulting the multidisciplinary team, I could potentially give blood transfusion if we all determine that this is the all of this is the best in the best interest for the patient. I have 1 second, please. Thanks. Also, after or before transfusing blood to this patient, just in case, I will have I will be familiar with the procedures of protecting my rights and the patient's rights. For instance, if the patient sues me, I'll go to I will know what to do in that case, so it doesn't put me or the patient in a disadvantage. Yep, thank you.
Thank you. You still have a minute.
Yeah. I think in the beginning, when the patient is admitted, just because I stopped the nosebleed doesn't mean there are any other underlying problems. And it is my duty as a doctor to put the patient in situations of of not harm. So I would try to investigate other underlying conditions before and not just stop at the nose bleeding, and make sure the patient is in stable condition. Thank you.
Thank you. That is your time.
Yep.
All right. My next question is, what do you think makes a good doctor?
I understand that a career in medicine is really challenging, and there are a lot of skills in which makes a good doctor. For instance, a good doctor should be a good leader, have excellent communication and teamworking skills, be resilient, and also have empathy as well. A doctor should be a good leader, because normally a doctor leads sort of a multidisciplinary team to achieve one function, which is to provide the best healthcare and safety for the patients. There was one time where I showed great leadership when I was the president of the Malaysian Society. I led a small committee members of 4 or 5 of us, and we organized many, many events. Being a good leader means not only being able to articulate, but also being able to listen to all the feedback, and that is what I did. I sat all my committee members down when we were organizing events. I listened to all of the feedback and incorporated it in every successive event. And I can say that all the events that we organized became more and more successful. Also, I believe that being a good doctor, you will have to have effective communication skills, because often as a doctor, you have to communicate with patients of different backgrounds and understanding of the subject matter. And it's very important as a doctor that you make sure they understand what the treatment entails and if they give consent. Also, you'll be communicating with the multidisciplinary team and other allied healthcare professions to give effective patient healthcare. And having good communication skills mean that there's less chance for miscommunication and patient safety error. So, for instance, one time where I showed great communication skills was during the time when I was a volunteer vaccinator. I noticed that a lot of patients who were coming to me were very needophobic, and I showed great communication skills with them. I adjusted my communication skills, lowered the tone of my voice, and made sure they understand what the vaccination was and the pros, the alternative options. I was honest, open, I showed integrity to them. I told them that, yes, the vaccination might hurt after you receive it for a couple of days. And I'm happy to say that a lot of patients consented to my vaccination, which shows that I have really good communication skills as well. Also, being a good doctor, you should have effective stress management skills. For instance, a doctor will be likely to face a lot of stressful situations, a lot of harrowing experiences in which stress over time build up would often lead to burnout. And this could compromise the capacity of the doctor to treat patients in a safe manner. Over the years, I can say that I've developed effective stress management skills. I have undergone lots of stressful work deadlines, for instance, or doing stressful degrees. And over time, I've built up a support network with my friends, family, my co-workers, where I can talk about all of my problems. And also during the weekends, I carry out activities such as playing golf or playing the piano to relieve my stress. I believe my stress management skills will help me in becoming a good doctor as well. And also, teamworking skills is very important as a doctor, because often doctors will have to work with a lot of different multidisciplinary team members, each with their own set of values and expertise. And it's very important for the doctor to delegate the task appropriately with the different members of the multidisciplinary team based on their strengths or weaknesses. There was one time where I showed great teamwork skills was when I participated in sort of a survival challenge for my Duke of Edinburgh award, where all of the students were divided into 5 groups of 5 members, and we had to survive in the jungle for 2 days without the intervention of any teachers. That was part of the challenge. Immediately, I put my teamworking and leadership skills at work. I delegated all the tasks to all of the members equally. For instance, one member was in charge of looking for food, the other was looking for a suitable place to build up shelter. All of us showed great teamwork skills and fulfilled all our delegated tasks really well. And I can say that we were one of the only 2 groups out of the 30 groups that managed to complete this challenge.
That's the end of the station.
Thank you.
Thank you. That concludes the first half of your MMI.
Yeah.
How are you feeling?
Oh, I just read up about the COVID like 30 minutes ago, so I'm glad I have an answer for that.
Yeah.
I think that's all, yeah. I'm pretty okay.
Yeah, I mean, I think there were tough questions.
Yeah.
But I think that you handled yourself really well. What do you think that you did well?
I answered it in a structured format. I related it back to the question, for instance, how I can become a good doctor. When presented with ethical scenarios, I weighed up the pros and cons. Yeah, I took my time to answer the questions.
And what do you think you'd like to improve for next time?
Probably more knowledge on the hot topics. Yeah, and probably when I'm given the scenario, maybe practicing that, understand it quicker, verbal reasoning. Yeah, that's all.
Okay, great. Well, I mean, I have some feedback for you that I can give you specifically for each question. So we can go through that if you're happy to.
Yes, thank you.
Yeah, okay. So I completely agree with you. I think that you did really, really well. I think that you remained really calm. You had really good body language and eye contact, really nice tone and pace. You took your time. The answers that you gave, you related them all back to medicine and why, certain skills are important for doctors to have, which is excellent.
Yeah.
I am going to go through each of the questions one by one and just mention a few things that I wrote down for each of them. So for the very first scenario, it was the role with your drunk medical student.
Yeah.
I think that you were very empathetic. You asked some really good questions, and then you really focused on patient safety. So even when Jack was being very difficult and just kept saying that they didn't really see an issue, you always highlighted the fact that he could be putting patients at risk, which is really good. And you offered some really good management techniques. So you were trying to be really helpful and say, hey, these are a few things that you can do.
Yeah.
I think some of the things that you could have maybe improved is firstly trying to establish what kind of relationship you have with Jack first. So if you're good friends, obviously then it will be different than if you are just meeting him for the first or the second time. So just, I guess, trying to understand, you could just ask, what is our relationship like? And then also making sure that you are speaking in an appropriate place and at a good time. So obviously, I think the scenario mentioned that you were in the lunchroom.
Yep.
Obviously, a lot of people might have been around. So maybe just making sure that the setting is correct for you to have that conversation.
Yep.
A few other things that you could have mentioned are things like professionalism. Obviously, as a medical student, you're not a doctor, you're not directly treating patients yet. However, you still do have the same responsibilities in many ways to uphold a medical reputation. And then also, you could have given Jack the opportunity to go and tell someone. But if Jack says, no, I'm not going to do anything about it, it then becomes your duty of care to do something. So you would have then had to escalate that to your supervisor or to, I don't know, a tutor or someone at the university. So if Jack says, absolutely no, I'm going to keep coming in every day drunk, then it then becomes your responsibility to do something about that. Just kind of mentioning, okay, I'll give him an opportunity to do something, but if not, it then becomes my responsibility.
Yep.
Does that make sense?
That makes sense. Yeah, thanks.
So yeah, those were just a few things that you could have touched on. When it comes to the public health question, I think really, really great knowledge of the COVID-19 vaccination program. You gave me a really good intro and an overview of what happened during the pandemic. Really great knowledge of how the vaccine works and everything that happens through the infection of COVID-19 and the effects that it might have on someone's health. You then spoke to me a lot about the vaccine and how it works, and you mentioned herd immunity. I think you gave like a really nice, what's the word? You used like not an anecdote, but you referred to the cells in your body of like being an army. So it made really, really easy to understand what you were saying.
Yep.
I think I would have focused a little bit more on public health. So you went very deeply into the context and the background and the infection.
Yeah.
The question itself focused more on what is public health. So you went into that like at the end when you had maybe a minute left.
Okay.
You're talking about herd immunity, the implications, the consequences of whether it was mandatory or not. My follow-up question was going to be, why is public health important? So it wasn't necessarily too much focusing on the ethical considerations of it, even though it was great that you did touch on that. But public health generally is you're trying to look after the health and well-being of a community as a whole. So how do we do that, and why is it important for us to do that in terms of prevention and management of disease? So it would have been great if maybe the intro could have been a little bit shorter, and if you focused a bit more on public health, that would have made that answer better.
Yeah.
Coming then to the 14-year-old who is asking you for contraception. Again, obviously a very difficult question, but I think that you answered it really, really well. You touched on capacity, and you gave me a really nice overview of what it means to have capacity. And then you mentioned the Gillick-Fraser guidelines.
Yep.
Do you know what they are, the Fraser guidelines?
It's like to test capacity for sexual health for under 16s?
Not specifically. So you are right in saying that you use them when it comes to, so the legal age is 16 in order for you to consent to that. However, anything under 13 it wouldn't apply to anyone who's under 13, because you would be under the legal age to consent to have sex if you're under 13. So it only applies to people who are 14 and 15.
And without informing the parents.
Yeah, so then that's the other thing. I don't think that you touched on informing the parents. So you mentioned a lot about the consequences and what would happen, which is great. The guidelines specifically, they are, so a GP has to assess certain things. So capacity is one of them, but there are 5 others. So you need to assess, are they going to continue having sex even if you don't to them? Is this in the patient's best interests? Can you not convince her to tell her family or to tell her parents? If not giving them the contraception is going to have a negative impact on their health. So those are like a few of the Fraser guidelines. So those are things that you mentioned specifically. So I would just have a read again of those. But otherwise, you did really well. You touched on safeguarding as well, which is super, super key. That's really important. And that you wanted to involve her in her own healthcare as well. Again, that's super important. So really well done. Question. Do you have any questions for me at this point?
If you don't get the time or enough time to answer all the questions on the examiner's list, do you get -1, -2?
I don't think that they penalize you. I think they have certain questions there. You don't always have to ask all of them, we're just trying, as an examiner, you're trying to understand if a candidate has sufficient knowledge and has answered the question well. So sometimes you can just assess that from one question.
Okay.
And sometimes you need to prompt students a little bit more. So if you hadn't mentioned Fraser guidelines, my next question would have been, do you know what the Fraser guidelines are? Does that make sense?
And you don't get penalized for them prompting you to say it, right?
No, I don't think so.
Okay, fair enough.
One thing that I always remind students is that examiners want you to do well. When we're assessing students, we are thinking, yes, come on, he's hit the Fraser guidelines. He's told me about safeguarding. He's told me about capacity. He's told me about consent. He's touched on ethics. Like, I'm rooting for you. Inside, I'm like, yes, Braden, you're killing it. Nice. So assessors, even though they're really stern, they're often very impressed and thinking, wow, he knows what he's talking about. So they want you to do well, if that makes sense.
Yep, makes sense. Thank you. Yep.
Completely fine.
Yep.
Okay, just moving on to the Jehovah's Witness question.
Yep.
Again, you did really well. You started off by talking about that you wouldn't want to make assumptions. You check for like an advance directive or a lasting power of attorney. I really, really loved that you mentioned that you'd rely on your team, and that you wanted to figure out how much time you had. That was really, really good. A few things that you could consider.
Yep.
Obviously, this person or this patient was 18. So at that age, legally, like, what would that mean? What would be different if she were 14?
The patient, okay.
So because it's an 18-year-old female, they'd be considered as an adult and therefore to make decisions for themselves legally under UK law. Something else that you can mention, obviously they're unconscious and you've seen that they have this card, but do you know if that person completed the card? Do you know if they were coerced into signing the card? Do you know anything? Is anyone else with the patient? Is there anyone else that you could speak to? So if this person's just come in, is mum around? Could you have a conversation with the family? Is there anyone else that you can call who can tell you the validity of this card that you've seen? Does that make sense? So you'd want to try and explore all of your avenues before coming to a decision, because obviously in this case it is life or death. It said, they're in a coma from blood loss and will die without a transfusion.
Yep.
Yeah, you obviously need to be making the right decision fairly quickly. But I mean, you touched on the best interests of the patient, which was great. When it comes to ethics, you could obviously have mentioned autonomy. So wanting to respect the autonomy of the patient. But I think with the time that you had, you gave a really good answer for that question. And then finally, what makes a good doctor? You gave me leader, a good communicator, teamwork, and empathy. And for each one of those, you gave me a really good example for how you have demonstrated this in your own life. You gave me a great example when you were a good leader of communication, stress management, teamwork, and then you told me how all of this relates back to medicine. So I don't really have any other comments for that question. I think that you did really well. Yeah, I think you did great.
Okay, so thank you for watching. I hope you found that useful. So now, as promised, I'm going to tell you exactly what you need to do to use that information to help you with your performance. So the first thing, like I said, please make sure you check out that online course, because that is going to give you the fundamental knowledge that you need to then be adaptable to do well at interview. It's like a pyramid, you need a solid foundation at the base, then you need to work on your performance, then we get into the nuances of how to deliver the answers best, and then we get to the pinnacle of the difficult questions and what to do when you put in a situation where you don't know the answer. But those, you can't start until you've got those foundations. So that course will give you everything that you need to make sure that you tick that box initially. The next thing is the importance of actually doing some one-on-one practice with someone. And if you wanted to check out the FutureDoc program, last year we had a 93% success rate in total. But of the people on the program, once they actually got to interview, we had a pretty much 100% success rate of training them so that they smashed the interview to turn that opportunity into an offer. But thank you for watching, and I'll see you in the next video.